Oh, yes. Sorry about that.
Yeah, it's all, no, totally fine. But yeah, you guys were talking about intersex conditions earlier and various surgeries and mutilations and things like that. And I happen to be the parent of a child with an intersex condition, or what's sometimes considered to be an intersex condition. And we wound up getting surgery for her. It was not at birth, but it was pretty early in life. And I didn't know if you guys wanted to explore that and talk about our reasons or...
Yeah, please.
Like that. Okay. Yeah. So when she was about 11 months old, we were about to lose our health insurance. And so it was kind of then or never. So that was kind of the first factor that played into it. There were also physiological things. Her condition is technically adrenal, but because of the imbalances in hormones, it presents with intermediate genitalia. And so there was a structural thing where she would have been prone to lots of like urinary tract infections and things like that. And I will admit there was a piece of it, much smaller piece, but a piece of it that kind of wanted her to be able to have a quote unquote normal life. Like I didn't want her to get teased in a locker room, things like that. And I do question that part of my reasoning, even though I know that the other two reasons were perfectly valid. But yeah, and so we went ahead and had the vaginoplasty. She, presented in every other way as female. She had all the female anatomy and the female chromosomes and everything like that. And so, yeah, we went ahead and got her a vaginoplasty, which, she's never had any problems with medically. And we've talked a little bit about it personally, and she is fine with it. She does identify, she's a teenager now. She does identify as female. And so, yeah, it's, that's kind of basically
don't
our
worry,
in a nutshell.
we're not judging you. Just to clarify, like these are not decisions. We've never been in that position where we had to make that decision for a child, like with all the other complications that come along with that. So like this is a judgment-free zone. This is Planet Fitness minus the sweat. So
I totally I totally appreciate that. But there were words used that are kind of derogatory, and I wanted to kind of present just like the most minor of alternative views where like sometimes it really is called for. And, like personally, I have two sons.
I think that's an important distinction.
No, thank you for,
so I kind of agree with that.
Yeah. No, thank you for pointing that all out. I appreciate that.
Yeah, I think it's really important, like, and we can contrast it with the last call a little bit. When we are talking about any of these medical procedures, I mean, oftentimes, whether it's because of a gender-related issue or a sex-related issue or just some other medical issue, parents have to step in and make these calls. And that is always something we're going to support. A medical doctor working with the parents or with the individual to do something that's going to encourage and promote health. We're totally on board. The contrast or the concern is when it steps into an area where we are kind of stifling variation and becoming hand-wringy and uncomfortable and trying to impose a certain value. That doesn't mean in the least bit that she shouldn't get the best possible medical care. And it sounds like that's a decision that you needed to make, and we, of course, support that.
Yeah, you made a medically valid and necessary decision for your child. There's nothing wrong with what you did, and there's nothing wrong with making those decisions.
Yeah, well, I mean, thank you very much for the validation. I appreciate that. But, but I kind of feel that way. Like I've felt that way when I decided to call, because I just, some people are very vehement about that kind of thing. And I just wanted to present the other side. And that's it.
I want to be clear. There are different situations for different people when it comes to a child that's been born intersex, obviously, because there are going to be different complications with the anatomy for each, and as you said, the hormones for each child. So you made the right decision for your child, as is clear.
Right. Well, thank you. Oh. And, unless you guys have any questions, that's pretty much it.
No, we so appreciate you calling.
Just, are you registered to vote? That's all I want to know.
Oh, yes, absolutely.
Cool.
Already mailed it in.
Wonderful.
Awesome. Thank you.
Glad to hear it.
All right. Thanks, Elle.
Bye.